Good
Good evening.
evening.
I want to thank Congresswoman Clark for inviting us all today. And if you know the CBC, the Congressional Black Caucus, you know that it is in our tradition to honor the folks who have driven the way. We have Maxine Waters and others. But Rep. Clark, thank you for allowing me to speak first. As the newest member of the Congressional Black Caucus, I want to be clear. I want to be clear why we are here and why we will not leave this floor until we all vote oh no every single Democrat. But the consciousness of the Congressional Black Caucus has always been that we have fought for poor people, we have fought for folks red and blue, we have been consistent, literally in the theology of freedom, that everyone deserves rightful treatment. When you are sick, you deserve health care. That our community should be abundant and that no one should be left behind. Many of you all have watched these folks as I have over the years, standing on the congressional floor, sometimes sitting on the floor, being a mirror to the evil that exists in that dome. And one of the things that we need to be clear about tonight as the CDC, and you will hear the whys of how our heroes who will march up those stairs in just an hour or so, what we will be bringing with us. We are bringing forth every single elder in our community that is on Medicare. We are building the love of the many foster parents that we are supporting and cheering for as they do the good work as the Republicans try to steal their Medicaid. We are loving on the young people in every single city in all 50 states and territories who are living off of $6 a SNAP a day and saying not only do you deserve that, you deserve more, while these folks behind us are trying to rip your dignity and take the literal benefits that your grandmother has worked for. We say, we are going to continue to fight and know that the Congressional Black Caucus will never falter. We will never give up. While we don't know what's going to happen on the other side of this vote overall, we know damn sure that black folks in Congress who belong to this caucus will never give up on our rightful assignment. And that is to consistently tell the truth, is to stand in unity. And I want to give it back to Representative Clark, and I want to thank you for your stewardship. And I want to thank you, Maxine and others, for leading the way for young people all over the country. To remember the words, and it's you all, to remember the words of Ella Baker. Ella Baker was so clear. She said, young people come first because you have the courage where we fail. If we do not fight for the now, there will be no future that you will own. So this movement is yours, and hopefully we will bring your voice up those stairs and make you proud. Miss Clark.
We're going to have Mark. Let me Mark. Right behind you.
Thank you, Congresswoman. You can see. I'm just beginning the assignment. Just Director Lisa Evans just giving a round of applause. His assignment, he's instructed me to instruct each of you and even from some of the organizations that he has, so I'll be interested in one or two others we'll hear from them tonight. He wants us, he wants each of you to articulate the why and the who and the why you are here. Speaking on behalf of any one of your constituents who is going to be affected or in fact devastated by what this big ugly bill will do. So that the people can hear us and we can meet them on the ground. That's what Vince is asked of us. Is that okay?
That's right.
Yes, me and y'all do that. I'm just coming up here and doing
No, thank you.
I'm trying to get on me. You want to do that first since you spoke?
Okay.
Describe who you're here for.
I'm here for folks who've led the way and folks who are waiting for us to continuously stand up for them. I'm here for, like I said, foster children, young people who are incarcerated, the men and women who are coming home from prisons and jails. We are here for the disabled community who are literally fighting to survive and fighting to live. Our wives are to be literally the vote that represents the folks who need us the most.
And please introduce yourself as you go, Dr. Church.
Benjamin Church, National Newspaper Publishers Association, representing the Black Press of America. I am so pleased to be here with the Congressional Caucus, and let me just succinctly say, 50 million Black Americans are opposed to this bill. And we've come today to stand with the Congressional Caucus. This bill is going to be devastating to Black Americans. It's going to be devastating to people who have Medicaid, devastating to people who can lose their health care. I have a sister, Constance Clark, who runs a rural hospital in Oxford, North Carolina. And she called me today, she said, they're going to have to close the hospital if this bill passes. So this is just not for the urban community, suburban community, it's also for the rural community. The people who are voting for this bill have no care about the majority of Americans. And so we have to stand with the CBC, we have to stand with all the communities to oppose this bill. Now and forevermore, never to allow this bill to be passed.
Thank you. I think if there's someone, if you want to hear about the personal stories of the people you know that are impacted by this. That's right.
Good evening. I'm Congresswoman Lauren Underwood. I'm honored to represent the 14th Congressional District of Illinois. And I am here thinking about the millions of Americans who get health care coverage through the Affordable Care Act or Obamacare, who have benefited from some tax credits that we had signed into law under Joe Biden that allowed 4 out of 5 people to get health care for $10 or less a month. Now, you all may know that I'm a registered nurse, and I have pre-existing conditions myself, and I have had Obamacare coverage, and I know what it means to get a bill for a premium that's expensive. And so the opportunity to lower health care costs for the American people was so popular that we had the lowest number of uninsured Americans in U.S. history. We did that, and this bill would rip it away. The Republicans have declined to extend these tax credits that have offered the promise of health care coverage to millions of Americans. And now we know that 17 million people will lose their coverage, and hundreds of millions more will see their costs rise when this bill passes. That's why I'll be voting no. And I want to remind people that none of this was inevitable. We have an opportunity right now to continue to raise our voices. And so if you haven't made a call to a House Republican and shared your own healthcare story, told them how the closure of a rural hospital or closure of a nursing home or closure of a community clinic would hurt you and your family and your community, please don't wait another moment. Pick up the phone and make a call right here to the United States Congress and let the House Republicans know the damage that they are inflicting on our communities. Thank you.
Wilson, who are you?
Hello, I'm Congresswoman Frederica Wilson.
Not on.
I'm Congresswoman Frederica Wilson from Miami, Florida. I'm a school principal, a former school principal, a former school teacher. And I know what happens when little children come to school hungry.
That's right.
When we cut SNAP,
That's right.
that's what's going to happen to these families. Children are not going to be able to come to school with a full breakfast and a full lunch because they have already cut it out in the budget. And I want you to know at Miami-Dade County, as an immigrant-rich community, they have built something called Alligator Alcatraz. The funding for Alligator Alcatraz is in this bill. It's $450 million a year to operate. So that's why I'm voting no. I'm voting because I represent so many Asian Americans, so many Hispanic Americans. My entire community is comprised of immigrants. So I am voting no, and I ask everybody to call your representatives from your state. They don't have to represent you, just from your state. There's a number that you call and they will ask you, who do you want to speak with? And tell them. And you inform that representative to vote no. No on this egregious, hateful bill that's going to cause so much unhappiness and death in the black community.
That's right.
Greetings, everyone. I'm Congresswoman Yvette D. Clarke, Chair of the Congressional Black Caucus and proud representative of New York's 9th Congressional District, located in Central and Southwest Brooklyn. And my district is in the crosshairs of this big, ugly bill. There's not a provision that these folks have cooked up that will not inflict pain and horror on the people of the 9th District of New York. Many people understand that in an urban environment, our safety net hospitals are the pillar on which our primary care infrastructure is established. When you have so many members of your community that see these institutions being starved of the resources they need, when they themselves lose the insurance they need to enter the doors of these institutions, we're talking about a collapse. And that collapse has a ripple effect across the entire city of New York, because we are all interconnected. I think about those families in my district that are currently utilizing their SNAP benefits to access food through food pantries. There is such an inflation in the cost of living in our nation that we are trying to find people when they won't have access. They won't have access to Medicaid. I think about the young people who have these gig jobs, and these we're part of the gig economy. They don't have health insurance, but they were able to access Medicaid. And so their primary care was assured because we, as a civil society, looked out for young people who are out there striking out on their own and just trying to get a leg up in this economy, in our society. This is probably the most wicked thing that a government could do to its own people. To its own people.
Yeah.
And to know that there are cowards in the Republican Party that are allowing their own people to suffer just to be able to sit at the feet of Donald Trump is just as horrific as we can ever imagine. I can't imagine what it is to give up my dignity to a man who doesn't deserve it, to be able to just maintain a seat in the Congress, but let my constituents suffer. Let my elders in my community suffer. Let the young people of our communities suffer. And so we are here to say hell no. Every Democrat in the House of Representatives will be voting no on this big, ugly bill.
In the crowd, let's give her a round of applause. Congressman Carter.
Congressman Troy Carter from Louisiana, representing the 2nd Congressional District. I want to first thank our chairman for bringing us together at a time when we really need it. And I will tell you, who am I here for? Who are we here for? We're the people that don't have a voice. We're the people that don't have a seat. that don't have a voice. But that's okay. We're here for you. And when we're at the table, you're at the table because we're going to continue to fight for you. This big, ugly bill is going to wreak havoc throughout our country. It's going to hurt the black community perhaps more than any other community. But guess what? They're going to hurt too. And these guys don't even care because they have taken the hook, line, and sinker to follow Donald Trump down a rabbit hole that they'll never come back from. People that will be denied Medicaid, who will lose their benefits one way or the other because they have made this so complex that you have to reapply and reapply. Listen, if you had to reapply for your driver's license twice a year, people wouldn't be able to drive. They know this because people are busy working, living, trying to raise their families. So their expectation is people, even though they may be eligible, will be kicked off the rolls because they make the paperwork so onerous that they can't keep up. This is a trick. This is a trick of an evil regime. And we are going to, as Congressional Black Caucus, we're going to continue to call it out. We're going to call balls and strikes. We're going to call it everywhere we go, with our fraternities, our sororities, in church organizations, with our faith-based communities, with our civil rights leaders, with the caucus and beyond. Because however they vote today or tomorrow, this battle's not over. We're never going to quit. We're never going to retreat. When I was in the state senate, we expanded Medicaid. And when we expanded Medicaid, one of the first things happened, tens of thousands of people got on the rolls. People started having access to health care. Rural hospitals started opening up. People that had been denied health care were now being covered. Guess what will happen now? The reverse is also true. Those rural hospitals will close. And that critical time when you're having a stroke or a heart attack, those precious moments that you no longer will have to get to a community clinic or a rural hospital, people will. In those moments where you have to drive 20, 30, 40, 50 miles to see a doctor when you've had a stroke or a heart attack, people are going to die. That's just a fact. That's a reality. And the notion that one of our senators said, we're all going to die. We don't need to die prematurely. And we don't need to die because we were denied access to health care. We don't need to die prematurely, although they seem to think, as Mitch McConnell said, don't worry, they'll get over it. No, we won't, Mitch. We're not going to get over it. We're never going to get over it. And we're going to continue to fight for the people. We're going to make sure that the people like the McCorkins, who are brought up from Louisiana to come to Energy and Commerce, who has a child that was born severely disabled, who requires Medicaid. Now, his mother and father both work. This notion that people who are on Medicaid are scofflaws and bums and gangsters and get-over artists is offensive and false. There are people out there that need Medicaid for a number of reasons. People who are employed but are underemployed. Working but still poor. Are you going to tell me that these people are scofflaws and bums? I think not. But that's what they think of you. That's what they think of our people. And this Congressional Black Caucus, all the people assembled, we don't think that. And we're going to fight for you. We're going to fight that you have access to health care. We're going to fight for you to have access to SNAP dollars, not $6 a day, because that's ridiculous. And they want to reduce it and take it away. This caucus, this Congress, on the Democratic side, will continue to fight for the people and bring justice. And we, us all, are going to vote against this big bill.
Congresswoman Joyce Baker.
Thank you. I'm Congresswoman Joyce Beatty. I hail from the 3rd Congressional District of the great state of Ohio, Chair Emerita of the Congressional Black Caucus. I am here to join my colleagues and our leader, Congresswoman Yvette Clarke, to say to you that I will be casting a no vote on this bill. Why am I here? I am here for those who we can call their names and those who are named. I am here for every family, every single mom, every sick child, every child trying to get a better education, whether they are in rural America or urban America. They deserve the right to keep their hospitals open. They deserve a right to keep health centers open. I'm here to vote no because this is the largest amount of Americans that will lose their health care. 17 million families and individuals are at jeopardy. Some 11 million children will be taken off of SNAP. I am here because I want all of America to know that we are not only the conscience of the Congress, but we are here because earlier today we stood up. We had a stand in because we are standing for the people. I am here because I want to make sure that we give this clarion call to answer your question. When you are asked, what is the Congressional Black Caucus doing? I don't want it to be a mistake. I want you to clearly say they are fighting for our people. They are standing up and making a difference. They are not afraid to call out Republicans. Let me make it clear that whether it is health care, whether it is the Pell Grant, whether it is SNAP, it is not a Republican or Democrat issue. It's a people's issue. But what is a Democrat and Republican issue is that Republicans do not have the courage to do what's right. And you should not forget that. My question to you is what you are going to do. And that is, you are going to vote. You are going to vote just as we are asking in the United States Capitol later tonight that we only need 4. We only need 4 Republicans to join us. So I need you to remember, we only need 4. 4 Republicans could save the lives of millions and millions of children, of families, of hardworking Americans. So join me and let's say we only need 4. We only need 4. And I yield back my time.
Thank you, Congressman Taylor. How this affects you, Congressman Hank Johnson, and those in your constituency?
Thank you, sir. Good evening, everyone. And I am proud to be here with my fellow members of the CBC, the Congressional Black Caucus, under the leadership of Chairwoman Yvette T. Clark, my classmate from the class of 2007. We've been in Congress for 19 years together, and so I'm privileged to be sharing this moment with you as well as my other members and the stakeholders who have joined us. You know, I think about over the last 40 plus years that I've been a resident of the community where I live, which is the 4th Congressional District of Georgia. I've seen the mushroom of kidney dialysis clinics popping up all throughout my community. In fact, you can look around in some places and there's a dialysis clinic on every corner. And it's not just older people who are going in 3 or 4 days a week to get dialysis to stay alive, because if they don't go, they will die. But it's young people too. That's right. Who are suffering from kidney disease, from diabetes, from high blood pressure. And there's thousands of them just in the 4th district who are making that trek every week, 3 or 4 times a week. And many of them work, but some of them can't work. But I'll tell you this, most of those people in those dialysis clinics could not be there unless they were on Medicaid.
And then there's a fair number who are also on Medicare. So in this big, ugly bill, we're cutting $1 trillion in Medicaid. We're cutting $500 billion in Medicare. And so we are also cutting subsidies that make health insurance affordable for people, because some of the people at the dialysis clinics are paying with private insurance. But when those subsidies go away, they won't have the private insurance. And so it is a catastrophe in the making that is going to lead to the deaths of thousands of people in this country if this bill passes. 50,000+ people per year are scheduled or predicted or projected to lose their lives because they are not going to have access to health care in the richest country on earth. That is a shame. It's a shame. And anybody who votes for this bill should be ashamed of themselves. So I'm here, along with my colleagues, to be the voice for the least of these, for those who are hungry, and we can feed them. I'm not going to be one of those who doesn't feed them. For the sick who need our care, I'm not going to be one who turns them away from care. And for the strangers, we call them strangers, but really that's a biblical term. I'm talking about our immigrants who are in this community, who we can shut the door or we can open the door so that we can all prosper. I'm here to speak for them as well. And I thank you all for being here.
Councilman Johnson. Thank you. Congresswoman Lucy McBath. Let's give her a round of applause.
Thank you. I'm Congresswoman Lucy McBath. I represent Georgia's 6th Congressional District, which is all of the suburbs of the Atlanta metropolitan area. And I do want to thank our chair, Congresswoman Yvette Clarke. I want to thank our chair emerita. I want to thank the leadership of the Congressional Black Caucus. I want to thank the organizations that are joining us here tonight. Thank you for your steadfast commitment to standing up for democracy, for the people all over the country that we are actually fighting for tonight. I will tell you, I'm voting no on this bill tonight. And I'm voting no on this bill tonight because as a 2-time breast cancer survivor, I remember sitting in the office with all the other women like myself as we were waiting to see our surgeon, our doctor, as we were waiting for care to make sure that we would survive and we would still live. And I remember the discussions that we used to have, the fears that we had about being able to pay for our care, pay for the surgeries, pay for the pharmaceuticals that we needed to keep us alive. And I remember the discussions that I had with women who were on Medicaid, who are afraid as to whether or not they were going to be able to pay for their care to keep them alive. We talked about our families. We talked about our children. We talked about, are we going to be here to carry on and to take care of our families? So I'm here tonight because I understand that I had good health care insurance and I've survived cancer twice. But I know there are so many women in this country, especially women of color, that if Medicaid is cut, if the financial resources are cut for their access to health care, they will not survive. They will have nowhere to turn. I'm here tonight to vote against this bill because I'm concerned about every woman in this country who has used Planned Parenthood as the only means of care, reproductive care, not just for abortion, but for their wellness checks, for birth control. And they won't have access to that anymore. Where are they going to go? Where are they going to get their help? I am here tonight to vote no on this bill because I have asked over and over again in the state of Georgia to our governor why he won't feed our children during the summer when they're in summer camp, why he refuses to feed our children, feed our babies, and I've never been able to get an answer. And now I'm even more afraid that they won't even be fed during the summer. They just won't have SNAP and these benefits at all. I'm here tonight to vote no on this bill because I'm so deeply and gravely concerned about what this means for the nation. We're talking about health care cuts. We're talking about public education cuts. We're talking about veterans cuts. We're talking about for those that have disabilities. We're talking about a whole gamut of cuts that will just completely rip the rug from underneath the feet of so many people in this country every single day that are just struggling to get by. So I'm voting no tonight for those people who don't have a voice. I'm voting no tonight against this diabolical, unethical, immoral piece of legislation that will change democracy here in the United States for generations to come. I'm voting no on this piece of legislation because all of the people who have been in this building, who've been in this Capitol, who've been on this hill long before I came, fought to undergird and support America. And I doggone if I'm going to let all the work that they've done go down in vain.
Thank you. Congressman Maxine Waters, for whom are you?
Hello, everybody. Let me thank all of my colleagues in the Black Caucus for all of the work that we do every day. And even though we have a crisis right now, you're fighting even when others don't know there is a crisis. That's right. We hear every day, whether it's on education, whether it's on health, whether it is on health care, whether it is on what we're confronted with today. Ladies and gentlemen, this just didn't happen. It happened because somebody made it happen. Who was it that got us in this position? You know who it is. It's the President of the United States of America, Donald Trump. You know that this unkind, cruel, low-down, dirty President of the United States has used his executive power, using his executive orders to change this country in ways that nobody ever thought could do. Our ancestors have fought very hard for us to come to the time when we could have halfway decent care. We come to the time where we would all be dying from preventable diseases. I have come from a time and place where families didn't have any primary doctor. The only way that you saw a doctor or got to a hospital was if you broke an arm or broke a leg or you got hit by a car. There was no such thing as preventive medicine. Many folks have sacrificed. They have worked hard to get us to a place where we can have halfway decent care. We still are working to make sure it is 100%. But before we can get there, this cruel president has taken his power, understanding that once the people elect you, that you can use your executive power to do whatever you want to do. And most people don't understand that. They think somehow we can rein him in, that somehow we should be able to arrest him because he's a criminal. But the fact of the matter is, the President of the United States has a lot of power. And that executive power is being used now to make sure that he takes care of the billionaires in this country and give them the tax breaks that they all want. You saw them at the inauguration, standing with him, proudly saying, now we're in charge, and we're going to do whatever we need to do to make sure that all of this government money is not going to those people. Who are they talking about? They're talking about us. They're talking about poor people. They're talking about people who work every day, who make minimum wages and low wages. They're talking about people, some of whom who work for them in rural communities that don't even know who's undermining them. We know, and we fight. I'm mad as hell. And I want to tell you It is not just about being here today. Of course, I'm not going to vote for the bill, but we've got to be on the street. We've got to be fighting in the way that the civil rights people taught us to fight. We've got to organize. We've got to get out there. The young people are interested. We have got to help them to understand. When they understood what happened up in Minneapolis, Black Lives Matter came alive. They were on the streets of America. We need them on the streets now. And so we don't know what's going to happen tonight. We don't know when the rule is going to come up. We don't know whether the rule is going to pass. We know that there are some members, both on the Republican side for the most part. The Democrats are all together. Yes. We have a wonderful leader in Hakeem Jeffries who kept the Democrats together in this Congress. And we all voted against this bill when it went through the House. It got to the Senate. They don't know which end is up. And now they've got some over there who have found out that their constituents are finding out that they have buyer's remorse. They didn't know when they voted for him that it meant them too. And so some of them are begging for us on this side to now bail them out. We need 4 votes, as Ms. Beatty has said, just 4 votes. But I want you to know we've got some scared, intimidated folks over there who's so worried about their primaries. Well, let me tell you about our primaries. Our primaries know when we're working for them. That's right. Our primaries know when we're fighting for them. And nobody with no big amount of money can take us out if we're doing the people's business. So we've got to do the people's business and to get it done to people and help the people to understand and to educate the people about what this government is and what it's all about. I want to tell you, Trump is in office, and his co-president, Elon Musk, and they got together and decided that the way to give that tax break was to get rid of so many employees doing all of this work that they don't need to do because the people they're doing it for don't deserve it anyway. Well, I want to tell you, I think they cheated in order to win in the first place. And I want to tell you, I am not intimidated by anybody, anytime, any place, anywhere. And so it is because of the strength of our conviction that we're going to win in the final analysis. That's right. Even if we don't get this vote tonight, we're going to win because we're going to fight harder. We're going to help people to understand what has happened. And understanding what has happened when you didn't know that the president had this kind of power is going to give you power. And never again should we be confronted with a president of the United States who's using the executive power to do what this Anya low-down, dirty, cruel man is doing. And so we hope that there are enough 4 votes, as this lady said, we hope there are 4 votes who will finally get some strength and say, sorry, Mr. President, we just can't give it to you. But we don't know whether that's going to happen or not. And I know a lot of people are praying that that will happen. I'm going to try to pray. I'm going to really try. But in addition to that, I'm going to continue to fight. Ladies and gentlemen, I'm 86 years old. I want you to know I've been on the street in 8 protests from California all throughout Washington, D.C. And guess what? I got strength for 8 more, 12 more. I will never stop. As a matter of fact, I decided I'm going to live till I'm about 110. Okay? And so it is that kind of strength. Come on! That's right. Nobody can stop you. That's right. Nobody can stop you. And ladies and gentlemen, we hope they do the right thing up there. But we don't know. And if they don't, we will not stop fighting anyway. Thank you very much.
Congressman Maxine Lawrence. Amen. Thank you. That's wonderful. And good from all the members. What we're going to do is hear from some young people, but we know members have busy schedules. If any of you have to leave, you have Vincent. You sure? Okay. And that's right, nice. The members are going to let the young people take a seat. Come on, you young people. That's what they said. They want to hear from you. All right. We're also, folks, we're streaming all over the country. People are watching this everywhere. There's a larger crowd watching than it may be here, and that's important. Now, Congresswoman is giving the young staff permission to cuss on the Capitol grounds. Amen. All right. Well, so let's go. Let's start here since I'm on this. We're also going to hear from Families USA and LDF. We appreciate them being here. Young people, we want to hear how this, while you're here, and how this personally affects you. Be sure to say your name and where you're from.
Hello everyone, my name is Caleb. I'm from New Orleans, Louisiana. I'm a rising sophomore at Yale University. I'm here today because I'm also serving in Congresswoman Lauren Underwood's office. I'm on the receiving end of countless phone calls from constituents worrying about everything they have going on, from older people worrying about their Medicare and Medicaid being cut off, to the younger people just worrying about other factors, and single mothers. My mother is a single mother herself. Living under a single mother's house has been really intense. At certain times, we've had SNAP benefits, and I could not imagine like living in a household where this would not be available to do. So I hope the Republicans, we need 4 votes. I hope 4 of us can be strong enough and condemn this administration and everything that's going on, because it's necessary. We're living in a very, very amazing time. Continue being amazing.
You see what I'm saying? Because I was like, y'all ain't got to sing it. I'm going to be able to sing it.
Hello everyone, my name is Jonathan McGee. I'm from Los Angeles, California, specifically the 43rd District of the Congressional District under Congresswoman Maxine Waters. And I am here today as a rising sophomore at Yale University, and I am a CF intern as well. And we are living in a time where we cannot allow the administration here today impact us in the way that they are, and taking vital programs away from the people of America. I personally have experience where my grandpa is on Medicare, and he is currently bedbound in a nursing facility in the middle of the valley in California. And we do not know what is going to happen to him after everything that has been going on with this administration, with the votes that have been happening, and everything in between the votes that have just been going on. So we need to mobilize and continue having spaces like this where we're able to talk about what is going on in America and how we can protect the lives of people everywhere, regardless of where they're from rural counties, from urban areas, and everything between. It's very important, and that is why I'm here, listening to constituents from all over the place that live in rural communities that are suffering from different places and different hospital-like conditions, medical conditions that are hurting them day in and day out. And we do not know what will happen to rural hospitals if they are gone. We do not know what's going to happen if SNAP and other benefits that are happening and impacting people across America are taken away. 17 million Americans are going to be at risk for several programs. We cannot let this happen. We need to continue fighting, and we need to make sure that we mobilize.
Good evening. I am Charles Walker Hoover. I am a member of the United States Student Association, as well as president of the UMass NAACP chapter. And I'm here today because, as a voice for students across the country, you can't cut Pell. You can't raise the price for student plus loans and parent plus loans. You can't privatize that, because if you privatize that, it leaves us vulnerable to private lenders who are sharks, who will do anything they can just to have you 30 years paying off student loans. And I'm here because education is a right. I believe education is a right for all. Where you come from, I'm here from Springfield, Massachusetts, and I didn't believe I would ever be here outside the Capitol, but I'm here because I'm a student of history, and today is the 64th anniversary of the Civil Rights Act being signed into law, and also the birthday of the late Supreme Court Justice Thurgood Marshall. So I think today is a day of history, a day of reckoning. We history will remember who those 4 Republicans are if they sign and say no to the big, beautiful, big, ugly bill. But if they go along with their party, history will remember them as well. History will remember what Donald Trump is doing and has done to this country. Insurrection or fake election and fraudulent election. History will remember, and that's why I'm here.
Let me just say, since our brother mentioned Thurgood Marshall and the Civil Rights Act, today is also the 100th birthday of Medgar Evers. And today is also born on the same day, the 100th birthday of Patrice Lumumba. So this is a freedom fighter day. Amen.
Hi, my name is Chloe Parkson, and I am here from a small town in Alabama. I attend the University of Alabama. If you ask me why I'm here, I would say I'm here because somebody has to speak up, somebody has to advocate, somebody has to make a change. If we all go along with this idea of selfishness, of not looking out for the people that cannot speak up for themselves, who will help us? No, 40% of Medicaid is children. If they can't sympathize with children, do you think they can sympathize with us? No, we have to advocate for ourselves as Black people, as minorities, and everybody else, not even just minorities. This bill will impact the entire nation. It's something that if it passes, you will tell the difference when you wake up the next morning. So make sure that you help to be the change, to be the positive impact, and not the negative.
Hello, my name is Joseph Cole. I'm from Las Vegas, Nevada, graduate of the University of Las Vegas. I'm a fellow CPCF intern, fellow interns who have just spoken and will speak. We come here in earnest efforts to advocate on behalf, not just the CPCF, but of our country. I'd be remiss if I were to go into this explanation without properly talking about my personal story. I am the son of Ethiopian immigrants who immigrated to Las Vegas in the late 1990s for the hope of a better life. Throughout my uprising and my upbringing, my parents went through great struggle to bring me and my sister up in a way that was pursuant to the American dream. They brought us in the world and in the city community that was multicultural in nature and had all the things that I believe in American democracy society should have. Today, in this bill, Congressional Republicans and this administration work to undo and undermine the very principles that constitute the community that I've loved so much. Democracy does die in darkness. We believe that everyone should become representatives, engaging within their governments and their institutions to ensure that their voices are properly heard for the forthcoming vote. The vote tomorrow will be more than just a political reconciliation bill. It'll be a referendum on the principles that constitute our American community. To the mother who's relied upon food stamps to feed her children, to the young woman in Las Vegas who's reliant upon Medicaid and Medicare to ensure that she has personal safety for her and her grandmother, to the young Ethiopian American boy who to this day still looks to America and questions what the world has to offer. We're looking at this bill and at this forthcoming votes as a vote for our democracy and the integrity of the United States. Thank you.
Good evening, everyone, and thank you guys for being here. My name is Malaya Mason. I am from Baltimore, Maryland. I attend the lovely Morgan State University. And mine is also a personal anecdote. Growing up, my family relied on Section 8. We relied on SNAP. A lot of the fresh produce that I have was because of the benefits that we received from SNAP. But Baltimore is one of the most, honestly, one of the most poverty-stricken cities. It's a majority Black city. We suffer from food deserts. I live in a food desert now, even just being on Morgan State University's campus. So I've seen what lack of food access does, not only to students, but to families, to individuals, and I've experienced it. Just moving along in my story, I moved out of my house at 16. You know, at 16, you don't know anything. I know I didn't know anything. So that meant that in order to receive health care, I had to rely on Medicaid, and I still do to this day. So I am one of the people who will be impacted by this bill in the event that it goes through. And because I was on SNAP, because I received free lunch, those are the reasons why I was able to attend college. I got fee waivers because I was able to rely on SNAP benefits. And I was able to attend Morgan State University on a full ride because I had the resources that I needed in order to obtain an education. I know a lot of students, especially a lot of young Black children from Baltimore, don't get that opportunity. So I'm here to advocate. I would say I'm here to advocate not only for myself, but for my community, for my sisters and brothers, for the people who were going through it just like me and didn't speak up, for my immigrant sisters and brothers, for my people who have experienced housing insecurity like I have. I'm here for everyone, and I'm proud to be. This is what we're here for.
Good evening, everybody. My name is Omema. I'm from Omaha, Nebraska, and I'm a fellow CBC intern. And I would be remiss if I didn't just acknowledge how privileged and honored I am to be able to share my story amongst my peers of how impactful this bill would be on all of our lives. Just to share a little bit about me, my family moved here in 2004 as refugees from South Sudan. It was Medicaid, it was Medicare, it was SNAP benefits that helped us get established in this country. It gave us peace of mind, knowing that we had food to eat, knowing that we had our essential services taken care of, that we could engage in our education. It was SNAP benefits that supported me through college, knowing that I could focus on classes, that I could focus on my education, and not worry about what I had to eat at the end of the day. I want my story and my testimony to be one that is representative of many across the United States who without this support, they wouldn't be able to establish themselves in a new country. Education has been the great equalizer in our society. Our ancestors have fought long and hard for our educational rights. We're all proud to be here today to be pursuing our education so that we may fight for the generation that follows and amongst our peers as well. So I would just be remiss to say that, I'm not proud and honored to be here, and just thank you for letting me share my story.
Good evening, everyone. My name is Roland Rowe, and I'm from Woodfield, Mississippi. I also attend Southern University of Agriculture and College at HBCU in Louisiana. Being from Mississippi, I am a CBC intern and representative of Benton Township District, which is Mississippi's second congressional district, which is one of the poorest congressional districts inside of the United States. We have a bunch of residents who rely on Medicaid and Medicare. As a student who attends at HBCU, as a student who receives a Pell Grant, as a student who is a part of the United States Army, and who just hit 5 years serving, choosing to serve in a country that he believes in, a bunch of Black veterans will be affected by this bill. This bill will now require students to take 15 credit hours to receive full Pell Grants. We know a bunch of students cannot take 15 credit hours because they have to take care of their aunties, their grandmothers, their mothers, their fathers. Have Republicans lost all human decency? All human decency in all facts.
Anthony Wright of Families USA.
Yeah. No, thank you. I am so privileged to be amongst these great young emerging leaders as well as those. That's amazing. Give them applause. As well as with the heroes from the Congressional Black Caucus earlier, folks that I have looked up to for my career. My name is Anthony Wright. I'm the Executive Director of Families USA, the longtime national healthcare consumer advocacy organization. Originally from the Bronx, New York. Yeah. I will tell my own story. I'll tell the Families USA story of working for over 40 years on the cause of trying to get everybody access to the care and coverage that they need, whether it's through Medicaid, the Child Health Insurance Program, and yes, the seminal righteous fight for the Affordable Care Act. And that is a little bit of what we're fighting about now, because the bill that we're talking about, the big bad betrayal of a bill, is a bill that would undo health coverage more than any other bill or piece of legislation in the history of the country. It is, if the Affordable Care Act was the biggest step forward, Medicaid and Medicare Act, and then the Affordable Care Act, this is the biggest withdrawal of coverage. And so why I'm here to support our good friends from the Congressional Black Caucus and other representatives who are voting no on this bill because of the harm it will do to coverage, to costs, to care, and to community. In terms of coverage, 17 million Americans will be pushed or priced out of coverage, both public and private coverage, both Medicaid and Marketplace, from things like additional paperwork burdens, having to reapply every year, to work reporting requirements, to just the increasing costs of coverage. The increased cost will be felt by millions more, whether it's increased premiums that people will start to face this fall, to increased cost sharing for people on Medicaid, to increased premiums because as more people fall off the coverage, then the rest of the people are in a smaller and sicker pool, which means premiums go up. And then the thing, the cut on care, which is the direct attacks on cuts on the way that states finance their Medicaid programs, things called provider taxes or state-directed payments. But that means less money for the hospital or the clinic near you, and especially for those places where Medicaid is the #1 budget line item, the primary payer, nursing homes, maternity wards, and rural hospitals in particular. And then finally, community. This bill specifically attacks certain communities, whether it's women and their reproductive health, the defunding Planned Parenthood, whether it's specific legal immigrants who are here, refugees, asylum seekers, that are specifically targeted in this bill. And just in general, when you cut, one of those studies my organization did was that the comparison of states that expanded Medicaid and states that didn't, that actually has a huge impact on maternal mortality for everybody, but especially for communities of color. And so this bill has dramatic cascading effects, not just on the people who will lose their coverage, not just the people who will see their coverage, their costs rise, but not just everybody on Medicaid, all 80 million Americans, but on literally everybody and the healthcare system that we all depend on. And that's why it's so essential that four Republican members see the light and vote no tonight. And if they don't, then we need to make sure that every time those consequences happen over the next few months and next few years, they recognize that it's because of this vote that people lost their coverage, people saw their costs rise, people saw their services scale back, and even some key institutions like hospitals and clinics closed. So please vote no to everybody in there. Thank you very much.
Thank you, Anthony. We're going to hear from one more young person. One more youth. And your brother mentioned Thurgood Marshall's birthday. This is the organization that he led, the Legal Defense Fund. Demetria McClain, give her a round of applause.
I am so honored to be here with these young people. Give them up, give a hand. It is auspicious that we are here on Thurgood Marshall's birthday. I am Demetria McClain, Director of Policy at the Legal Defense Fund. We are a nonprofit, nonpartisan organization. Okay, we are the premier racial justice legal organization in this country, started by Thurgood Marshall 85 years ago this year. And so what we do at LDF is that we fight for the humanity and the dignity of black communities. And let me tell you something, this bill is not about the humanity or dignity of black communities or other communities as far as I'm concerned. And let me just tell you a little bit about what we do. A lot of our work is in the South. We do a lot of work in the South. Glad to hear people from Louisiana, Mississippi. And in this work that we do, either through litigation, research, organizing, policy advocacy, we meet a lot of people. One of the things that we're working on right now has to do with water equity, right? Food, shelter, water. These are the basics. We're not talking about thriving. We're just talking about surviving. And so we're working with families, elderly families in the South, right? Families with disabilities in the South. Families with children in the South who do not have clean water, or the bills are so high that they can't keep the roof over their heads because we all know what? That the rent is too what? Damn high. So we're talking about survival issues here, okay? We're talking about health. We're talking about taking food out of these grandparents who are on Medicare and Medicaid, who need the SNAP to take care of the grandchild, who's in the Title I school. My children were in the Title I school. And let me tell you something. Every Friday, the nonprofits would line up to bring boxes of food, and those families were in line. But guess what? There are not enough churches and nonprofits to get us out of this at this moment, okay? So this bill, I spent all morning, all day, walking up and down Rayburn Building, the Cannon Building, as well as Longworth, trying to convince people to vote no, because this bill is not about humanity or dignity. So what can you do? You can call 202-224-3121 and say vote no. Thank you.
Demetria McCain, and then we'll give her a round of applause. Let's give all these young people a round of applause. We've got one more speaker here from